Hi, my name is Dr. Marc Sher. I am a general dentist. I practice at enamel clinics in Cape Town. I've been in practice for 12 years, and recently, in the last 4 or 5 years, I have been using Myobrace. I use Myobrace for inceptive orthodontics for my younger patients. What I really loved about Myobrace when I first started using it, especially the K series, was that I felt that this appliance could do no physical harm or damage to my patients when diagnosed correctly. It is not an appliance that is fixed to any teeth. It's not an appliance that puts force on any areas of the mouth. And because of that, because of the low level of invasiveness, I found that Myobrace was going to suit the way I treat my younger patients in their inceptive mixed dentition years. And it really has completely transformed the way I practice and the way I see and now deal with my younger patients. In fact, now starting to get more confident in introducing this into my middle-aged or teenage patients because the results have been so incredibly profound with the kids that I've seen. It really is incredible to realize that a lot of the problems we see with malocclusion start as young as in toddler years. If a poor oral habit is developed, that can be anything from a tongue thrust, a reverse swallow, incompetent lips, and that all then kind of stems into deteriorating sometimes the health and well-being of the children, especially when it comes to breathing through their nose and well, most of my kids with malocclusions do not breathe comfortably through their nose; they breathe through their mouth. And what really encompasses the entire ethos around Myobrace, which really I try and explain to my parents, is let's forget about the teeth and let's focus on the airway. And if you are anywhere in this modern day of treating in medicine and dentistry and treating the patient holistically, the airway is the most profound research and treatment that is now being discovered and being promoted, especially when it comes to a healthy lifestyle and more so in dentistry, in correct jaw development. And having a patent and open and unobstructed airway is really a goal that we're trying to achieve. And if we can achieve that in the early orthodontic years or early years of our patients, where inceptive orthodontics is really necessary, then I would never hesitate to use a Myobrace appliance. It is profoundly beneficial if used correctly. It can really change my patients, or it has changed my patients' lives. I've seen results in all my compliant patients, and that really, for me, it really cements the fact that this appliance has a place in dentistry and has a place to stay. Yes, it's compliance-based. Yes, we might be in treatment for a couple of months, if not a year or two, but it really does make sense to me that there is no invasive treatment involved here. And so I am a firm believer that Myobrace is here to stay. It's only going to become more and more recognized as our modern dental and medical partners start to see the benefits. And I am proud to be one of the pioneers in my city, in my country, to use Myobrace. And I'm proud to stand by the brand and my colleagues that represent the brand. I really see that we're affecting a positive change in our patients' lives, in their dental development and their airway development. And for that reason, I feel that we cannot ignore the fact that this appliance does so much good. Thank you very much, and I hope that this is seen as my honest opinion on the product. There are obviously going to be debates around whether the scientific evidence is out there. I urge all my clinician colleagues to think with an open mind, to look at the anecdotal evidence, to look at treatments that have been successful with Myobrace, and pick your cases correctly, and let's change the functional development of our kids in a non-invasive way. Thank you very much.